Everything's new with breast augmentation. For years and years, we only had saline implants and then we had silicone implants. But nowadays we have shaped implants, and they have several different names. They can go by gummy bear, they can go by cohesive gel, anatomic, teardrop, cross-linked, and we have several different companies now, whereas before we only had either one or two companies. So these implants have really changed the way that we think about breast augmentation. With saline implants and silicone implants from the old days, we would use a round implant, and it would give kind of a round appearance. Sometimes people don't want necessarily just a round appearance, especially if they're particularly thin, because it can be very visible. Sometimes you want to fill the upper pole just a little bit, and that's where the shaped implant does a great job. So we have a couple different companies. They come in all different heights, widths, and projections. So we have the ability to do your measurements, and based on your measurements, we can help guide you with different sizing and things like that. What we don't want is to put a big implant in a very narrow chest, because it will make for wrinkles and things like that. So we do these measurements in order to help guide you. These implants, the shaped implants or the gummy bear implants, have a texture to them. The goal is for the texture to hold it in position, almost kind of like a Velcro in the area. It is always possible that the implant could move or rotate. I haven't had that happen yet in my practice, but it's always possible that it will. With these anatomic teardrop implants, you want to have the fullness in the lower part of the breast. With these implants, if you put too big of an implant, these implants are a little firmer, and that's why you can get those wrinkles. Some of these other implants, the saline and the older silicone or the 4th generation silicone implants, are a little bit more forgiving because they're just a little softer, whereas these gummy bear implants are just a little bit firmer. That's why they really have to sit flat on the chest wall, and you don't want to have them have the wrinkles. So we do a great job with measurements, with exam, with helping guiding for patients. We also have Chrysalix, which is a 3D program. And the Chrysalix is no guarantee of outcome, but what it does is it takes a picture of you, and then it allows you to use 3D imaging to try on different styles of implants. So we have all these implants available for you, and you could try on like a 350 or a 450 in a different height, width, and projection, and you can see what might look good on you. So what's new in breast augmentation? A lot has changed for breast augmentation, and the thought is that these implants will have a lower leak rate long term.